A new study from Harvard Medical School indicates COVID-19 vaccines are safe for people who are pregnant or breastfeeding. Joining us now to discuss these findings is Dr. Tali Bogler, Chair of Family Medicine Obstetrics at St. Michael's Hospital in Toronto and co-founder of Pandemic Pregnancy Guide on Instagram. Thank you so much for joining us this morning.
Thanks for having me, Andrea.
All right, so let's start with the risks involved for pregnant women who have COVID-19. What do people need to be aware of?
Yeah, so people need to be aware of that over the pandemic, we've learned a lot more about the risk in pregnancy. And what we've seen is that there is an abundance now of international and Canadian data pointing to the fact that pregnant women and individuals with COVID-19 have an increased risk of hospitalization, ICU admission, preterm birth, and other serious outcomes compared to non-pregnant women and individuals. And I think at the beginning of the pandemic, we didn't know so much about what the risk is, but we do have a better understanding now, and there is an increased risk.
Yeah. All right. So there's data which indicates the safety of these vaccines for pregnant women. How does it protect them? If you could break that down for us.
Yeah, so at the beginning of the pandemic, again, with the emergence of vaccines, we didn't have data on pregnant women because pregnant individuals were not included in the phase 3 trials for the vaccines. But now we have an abundance of real world data. So in the United States, over 100,000 pregnant women have received the vaccine and are part of a registry that are monitoring side effects of the vaccine. And there have been no safety signals in terms of pregnancy outcomes or baby neonatal outcomes. So that is very reassuring. Actually, at the end of April, there was a really good study out of New England Journal of Medicine, which again showed that pregnant women, specifically in the third trimester, there were no safety signals in terms of adverse pregnancy outcomes or neonatal outcomes. So there are more and more studies showing that, one, they are effective, meaning that pregnant women mount as good of an immune response as someone who's not pregnant. Actually, and the side effect profiles are really not that different between pregnant women and individuals compared to non-pregnant women. Actually, they might have less systemic side effects, meaning they might have less fevers or feeling unwell than a non-pregnant person, which is quite interesting. And the other thing is the antibodies that the pregnant person develops actually can transfer through the placenta to the baby and has been found in breast milk. So not only are you protecting yourself from getting severely sick, you are also protecting your baby.
Yeah, which is very important for new moms, of course. All right, so it's safe for pregnant women. What about teenagers? As you know, children 12 and up can now get vaccinated, but there's a lot of concerns that it can affect their menstruation and fertility. What are the facts on that?
Okay, so let's break it down. So talking about menstruation, there have been no studies proving that there's actually a connection between the COVID-19 vaccine and irregular menstrual cycles. Anecdotally, people have reported after getting the vaccine that there may be some earlier spotting, there may be some heavier menstruation, or maybe more painful for that cycle immediately after the vaccine. But it's not long term. So it's that month after the vaccine and it doesn't persist. So first of all, again, there's no data actually showing that link, but if there is a link, it's short term, it's not long term. And this issue with fertility is a long-term issue that anti-vaccine groups have always sort of signaled, oh, but what about future fertility? And have sort of used this to elicit fear. And I understand that people might be concerned about that, but there is no evidence linking the vaccine or any vaccines for that matter with future fertility. This was a myth that was spread from a non-reputable site that showed that maybe there are some sequence similarities between the spike protein that the vaccine induces and a protein that is important for placental development. But when they actually looked at that sequence, it's a tiny little proportion that's similar. We have lots of similarities between proteins in our body, but this would not be enough of a similarity for our antibodies to not only attack the spike protein, but to attack the placenta protein. It's not true, it's not factual, and I would not be concerned about future fertility.
All right, thank you so much for breaking that down and clearing that up. All right, so will the vaccine become necessary for pregnant women to get even after the pandemic is over, like the flu shot, say?
Yeah, so it might be. And the interesting part about this, even if the pandemic is over, there are vaccines that we recommend to pregnant women and individuals to get in their pregnancy, not only to protect themselves, but to actually protect the baby. Because we know that when the babies are born, they're not eligible to receive vaccines until 2 months, 4 months of age. And in that 2-month period, they can be especially vulnerable. So actually, if we give vaccines in the pregnancy and the mother has a boost of antibodies, those antibodies can then be transferred through the placenta and actually protect the baby. So there are actually lots of vaccines that we give to the mom in pregnancy that's less to do about their own risk, but to actually protect their baby who won't be eligible for the vaccine potentially for a while. So I think this probably might be one of those vaccines that we look into for that specific reason. And it's the same reason why we recommend the whooping cough in pregnancy. It's not necessarily to protect the mother, but we actually know there's a boost in antibodies that get transferred to the baby, and then the baby's protected against the whooping cough for the first 2 months of age. So, we have lots of data showing that vaccines in pregnancy are safe for this exact reason.
Well, thank you so much for breaking all of that down. Great conversation. Once again, that is Dr. Tali Bogler. Thanks again for your time this morning.
No problem. Thanks for having me.